National Mental Health Policy. Mental health has been a subject of rather ridicule, highly private, and even associated with shame at individual and family and society level. Therefore, at the national level, national mental health is a neglected and undiscussed subject at the government levels. However, in the recent times, there has been increasing awareness about the widespread nature of the mental illness, its ill effects at not only individual levels but also at the family and society levels. The government now has woken up to this issue and it has formed what is called a National Mental Health Policy. In this essay, we will discuss various issues associated with the mental health at various levels and also the features of the proposed mental health policy of the government. World Health Organization has predicted about 20% of India's population would suffer from some or the other form of mental illness by 2020. Our country has only about 3,500 psychiatrists to deal with this problem, and according to WHO estimates, 76 to 85% of the people with severe mental illnesses do not at all receive treatment, especially in the low and middle income countries group, and it includes India as well. Now, according to WHO report, India belongs to the category of nations in which suicide rates are more than 21.1 per 100,000 population, which is fairly a big ratio. It is a definite red zone as far as the global statistics are concerned. Recently, the Bangalore, the IT capital of India, has hit the headlines of the newspapers, and it has gained a distinction of becoming the unofficial suicide capital of India. Therefore, the government is confronted with the problem of dealing with this mental health problems and also the state of mental health care in India. Recognizing the gravity of the situation, the government announced a national mental health policy. The Minister of Health announced therefore October 10th every year as a National Mental Health Day. National Mental Health Day will be an occasion to generate awareness against stigmatization of people with mental illnesses and highlight the symptoms and remedial opportunities that exist, especially for those with such mental illness such as depression, schizophrenia, bipolar syndrome, etc. Now, this is the first national mental health policy and it was formulated and released on October 2014. Now, let us see what the policy envisages. The National Mental Health Policy envisages dynamic engagement, and it is expected to accommodate future thinking and developments in the field. First of all, there is a universal health insurance scheme, and which is a component of universal health mission itself, and it is being proposed that this universal health insurance scheme will cover those who also need a treatment for common problems associated with the mental health. This policy therefore acknowledges the significance and importance of relevant and useful local knowledge and practices that are available in the mental health area. Significantly, there is also need to address the social determinants of mental health because it has so much connected with the mental health. These determinants are poverty, environmental issues, and education, and they are required to be recognized properly. The mental health policy, therefore, is supposed to be inclusive in nature, and it incorporates an integrated and participatory rights and evidence-based approach. Mental health issues are addressed, therefore, in a comprehensive manner and it will deal with the issues of medical and non-medical aspects of mental health. Now, before you go into the official version of goals and objectives of the National Mental Health Policy, we'll try to understand the issues and factors which are responsible for the mental health of the country. One of the main issues here is the presence of mental illnesses. This has to be recognized. Presence of medical illnesses, especially those that are chronic, painful, or end-stage conditions such as AIDS or cancer, and depression and schizophrenia are associated with high suicide risks. Drug and alcohol is a major factor. Drinking and taking drugs are definite risk factors for suicide. A family history of suicide shows that those having a first-degree relative and who has committed suicide increases the risk of suicide in the individual. Mental health also is associated with stigma of the society. Persons with mental health problems face stigma and discrimination in many ways. Families are frequently unwilling to recognize the presence of such illnesses. Families, parents, and other caregivers may sometimes be reluctant or even afraid to seek a professional help. Further, there is the absence of available, effective, and affordable services in the mental health area, and it is a major barrier in large parts of the country. There is a widespread lack of knowledge on the nature and prevalence of mental health problems, and there is lack of knowledge is accompanied by fear and even hostility towards those with mental health problems. And because of this, such persons face exclusion from the society itself. Now let us identify the vulnerable populations which face the mental health issues. Vulnerable populations in India would include children, both school-going and out of school, women, and economically and socially deprived population groups, older persons, especially with physical disabilities. Now, poverty is an important factor here. Poverty and mental health are inextricably linked in a negative vicious cycle. Groups are more vulnerable to mental health problems. Now, the mental health is a vicious cycle. Out-of-pocket spending towards the mental health services and also associated loss of productivity, that is earning, increases the poverty level further. Now, homelessness is another factor. There are several linkages between homelessness and mental health. Homelessness can occur as an adverse consequence of a mental health problem itself. Persons could either be abandoned by a poorly resourced and helpless, uncaring family, and such person will wander away in the absence of accessible and appropriate mental health care system. Conversely, the stress of living on the streets and sleeping rough can contribute to the risk of developing mental health problems. Now, persons inside custodial institutions face a severe mental health situations. Persons in a custodial institutions fall into different categories, and they do have multiple vulnerable situations. For example, they include women and children in rescue homes, children in institutions under the Juvenile Justice Act, for example, and also people in beggar homes and long stay homes under the government institutions such as under-trial institutions and also convicts in prisons. It's a big group coming under all these categories. Now, at present, mental health services for these vulnerable groups are totally inadequate. Further, there are large section of population which is orphaned persons with mental illness. It is believed that 70 to 80% of the persons with mental disorders in India live with their families. This is true across all demographic social variables. Once the existing caregivers are no more, there is no provision for such home care and support for these persons. As a result, many of them languish till death, either due to starvation or lack of critical support systems like medicines, personal hygiene, and even food. Now, children of persons with mental health problems is another group which is quite vulnerable to mental sickness. Children of persons with mental health problems are vulnerable and their needs have not been adequately addressed at the family or society level. They are likely to be exposed to a range of adversities, and it includes poor parental care, there is a disruption in parenting, there is a problem in schooling, and it also has a side effect of increasing the poverty itself in the family. Elderly caregivers is another vulnerable group, because elderly caregivers whose own physical and mental health is not good, they become much more vulnerable. They have unmet needs, and it creates a negative impact on the lives of those who are dependent on them. Now, let us see what are the basic visions of the National Mental Health Policy and how it has been framed on various issues. The government believes that the mental health is an integral part of our overall health endeavors as per the policy pronunciation. The government has adopted what is called a holistic approach, and it recognizes strong linkage of body, mind and soul or spirit. Strengthening of health infrastructure must be effected, along with addressing the social determinants such as physical health and mental health. This National Mental Health Policy, therefore, is in consonance with the intent of World Health Assembly resolution that was taken in 2013. Therefore, World Health Assembly resolution forms the basis for our National Mental Health Policy as well. Now, let us see the overall vision of the National Mental Health Policy of India. The vision of National Mental Health Policy is to promote mental health, prevent mental illness, enable recovery from the mental illness, promote destigmatization and desegregation, and ensure socio-economic inclusion of persons affected by mental illness, and that is by providing accessible, affordable and quality health and social care. This has to be extended to all persons through their entire lifespan, and it will have to be within the rights-based framework approach. Now, values and principles that have been defined are important to remember in this mental health policy. To start with, it is equity. Mental health services should be sensitive and relevant to diverse social and cultural situations and groups, and it should be to the needs of the remote and rural areas also. An equitable share of national health budget, therefore, will have to be allotted, and it should be consistent with the burden of mental health problems and mental illnesses that exist across the nation. It should be non-discriminatory, and there should be equal opportunities for education, employment, housing and social welfare to the sections of people who are affected by mental health issues. Next comes justice. The needs of the vulnerable and excluded members of the community, that is, the people who are affected by mental health, should receive a particular attention that is a part of the justice delivery system. Integrated care. Mental health services should be provided within the existing health care system, and it should use the primary health care approach in dealing with the mental health issues. And therefore, the healthcare system should have a universal access, there should be equitable distribution, community participation, and what is called intersectorial coordination, and the use of appropriate technology will have to be employed to deal with the big dimension of the problem. It is essential, therefore, to make mental health services universally available and accessible and it has to be in a time-bound manner. Mental health services, therefore, should be comprehensive and should address the needs of the persons with mental illness in all its totality. And the care providers and health care professionals will have to be involved in this. Evidence-based care is a scientific approach, and the evidence-based interventions therefore will have to form the basis of decisions with respect to the provision of basic services that are required to be given to the people suffering from the mental health. Decision making therefore will have to be based on various evidences and examinations and laboratory results, and also from the research and practices, and also feedback from the clients. Quality is one important issue here. Mental health services should meet the quality standards as mandated globally, and it should be pursued suitable by local users also and caregivers also. Participatory and rights-based approach. Service users and caregivers should be involved in the planning, development, delivery, monitoring and evaluation of mental health services. Meantime, human rights and dignity of persons with mental health problems will have to be respected, it will have to be protected and promoted. Now we come to the issue of governance and effective delivery under the National Mental Health Policy. The union and state governments have a major role in actions for the promotion of mental health, prevention of mental health illness, and treatment of mental illness in the country. The governments, however, alone cannot ensure effective delivery. There are other stakeholders. They are private care providers, civil society organizations, that is NGOs, then there are user groups, the academic and research institutions, and they also play a crucial role in delivering and also guiding the policy matters. In all this, there has to be a value-based approach, especially in training and teaching programs associated with the national mental health programs. Core values such as quality, integrity, justice, accountability, and empathy will have to be built into all forms of training and academic teaching. The strategic areas which are identified for action in these areas are effective governance and accountability, promotion of mental health prevention and mental disorders and suicide, universal access to mental health services, and increased availability of human resources for mental health, community participation, research, monitoring and evaluation. To conclude, the specific goals and objectives of National Mental Health Policy are to reduce distress, disability, and excluding the morbidity and premature mortality associated with the people having a mental health problems. Further, to enhance the understanding of mental health in the country and to strengthen the leadership in the mental health sector at the national, state and district levels. The National Mental Health Policy also aims to provide universal access to mental health care. It aims to increase access and utilization of existing as well as future comprehensive mental health services, and these services would include prevention services, treatment, care and support services. Further, the policy aims to increase access to mental health services for vulnerable groups, including those who are homeless persons, persons in remote areas, persons who are living in difficult terrains, and the population which is educationally, socially, economically deprived class. The mental health policy also reduces the prevalence and impact of risk factors associated with mental health problems. The policy also aims to reduce risk and incidence of suicide and attempted suicide. It aims to ensure respect for rights and protection from harm of persons with mental health problems as well. That is, to take care of the people who are living with the mentally affected people. The policy also aims to reduce stigma associated with mental health problems. The policy aims to enhance availability and equitable distribution of skilled human resources for mental health. The policy aims to progressively enhance the financial allocation and improve utilization for mental health promotion and care. The policy identifies and addresses the social, biological, psychological determinants of mental health problems, and finally, it aims to provide appropriate interventions